Cervical health is a critical aspect of overall well-being for women, encompassing the prevention, detection, and management of conditions that affect the cervix. The cervix plays a vital role in reproductive health, and maintaining its well-being is essential for preventing cervical cancer, a significant health concern worldwide. In this video, we will explore the importance of cervical health, focusing on raising awareness, the significance of PAP smears, and the role of HPV vaccinations in preventing cervical diseases. Importance of cervical health. Cervical health is integral to a woman's overall health and reproductive system. The cervix connects the uterus to the vagina and is crucial for fertility and pregnancy. Unfortunately, it is also susceptible to various health issues, with cervical cancer being one of the most prevalent and preventable conditions. Cervical cancer is primarily caused by persistent infection with certain strains of the human papillomavirus, HPV, emphasizing the need for proactive measures to maintain cervical health. Raising awareness. Raising awareness about cervical health is paramount in preventing and combating cervical diseases. Many women may not fully comprehend the risks associated with neglecting cervical health or the preventive measures available. Educational campaigns, community outreach programs, and media initiatives play a pivotal role in disseminating information about the importance of regular screenings, vaccinations, and overall cervical health. PAP smears, a crucial screening tool. PAP smears, also known as PAP tests or cervical cytology, are instrumental in detecting abnormalities in cervical cells that may indicate precancerous or cancerous changes. Regular PAP smears are recommended for women, typically starting around the age of 25, UK, and should be performed every 3 years. These screenings aid in the early detection of cervical abnormalities, allowing for timely intervention and preventing the progression to cervical cancer. PAP smears involve collecting a small sample of cervical cells during a pelvic exam. The cells are then examined under a microscope to identify any irregularities. Early detection through PAP smears has significantly contributed to a decline in cervical cancer rates in regions with robust screening programs. HPV vaccinations, a preventive approach. Human papillomavirus, HPV, is a common sexually transmitted infection that plays a significant role in the development of cervical cancer. HPV vaccines, such as Gardasil and Cervarix, have been developed to protect against the most high-risk HPV strains. These vaccines are most effective when administered before exposure to the virus, making them an essential preventive measure for adolescents and young adults. Routine HPV vaccinations are recommended for both males and females, typically starting at the age of 11 or 12. Vaccination not only protects against cervical cancer but also guards against other HPV-related cancers, such as those affecting the genital, anal, and oropharyngeal regions. The widespread adoption of HPV vaccinations is a crucial step towards reducing the incidence of cervical cancer and associated health burdens. Challenges and solutions. Despite the benefits of PAP smears and HPV vaccinations, several challenges persist in ensuring widespread adoption. These include limited access to healthcare, inadequate education, and cultural stigmas surrounding reproductive health. Addressing these challenges requires a multifaceted approach, involving healthcare providers, educators, policymakers, and community leaders. Cervical health is a cornerstone of women's overall well-being, and preventive measures such as PAP smears and HPV vaccinations are pivotal in reducing the burden of cervical diseases. Raising awareness about the importance of cervical health, promoting regular screenings, and ensuring widespread access to vaccinations are essential steps towards a healthier future for women. By fostering a comprehensive understanding of cervical health, we can empower individuals and communities to take proactive measures, ultimately contributing to the global effort to eliminate cervical cancer and improve women's reproductive health.